Colorectal cancer screening programs are imperative, as these are things that usually progress in a manner that, when caught with screening, they can be treated and avoid cancer altogether. Cancer, colon cancer specifically, is the third leading cause of death in the United States among men and women.
Collaboration with partners in the community is key for this to really happen, because so many of the people that we're trying to reach with a screening program like this, they just haven't had maybe a good history with healthcare, or they don't have a trust, they have a mistrust for whatever reason, but then these partners are trusted by the populations we're trying to reach. And so they're the best ones to be delivering the information, following up with the information, and it also strengthens their relationship with that population. So it's a win-win all around.
When we do put things off and find it down the road, unfortunately that can lead to worse outcomes or cancer that's not operable or maybe not treatable.
So you can feel great and have cancer growing. We can catch this early, and then they can be on with their life and continue with their loved ones. But if we don't nip it, then the options are less, and possibly your time with your loved ones is less.
I would say it's easy to just say, maybe next year I'll do that, or put things off, thinking that, maybe you'll financially be ready then, and it's just push off kind of thing.
Go get screened, because the not knowing is scary. Even when you go get tested and you waiting, or if they found polyps and they like, okay, we got to go in and test the polyps, the not knowing. And so I think everybody, if you old enough, go get that screening, because you can be saved, because colon is treatable.
We are providing free colorectal screening at-home screening kits, and that is more geared towards the underserved and underinsured, so kind of breaking down that barrier. Last year, our goal was to give away 500 kits. We exceeded that by giving away 603, I think. Our goal this year is to give away 700, and we hope to increase the return rate from 16% to 25% just by connecting back to the people and making sure they get their kits turned in.
This is a simple stool test that looks for potential early detector factors that could lead to needing a colonoscopy.
It doesn't take that much time. You can mail it back. We've got these kits now that are you can just do them in a few minutes at your home, mail them back, and you can have peace of mind.
In 2020 alone, because of the pandemic, there was an estimated 9.4 million screenings that were delayed. And so that creates a lot of issues, but late stage diagnoses, more treatments, and an increase for death, of course. It was really kind of a joint force between Union Point and Gilda's Club coming together to decide on how and what we wanted to do. And colorectal, being the third most common type of cancer, was why we selected that.
We were seeing younger patients being diagnosed, and it is imperative, if they get their screening appropriately, that they could avoid cancer altogether. This is something that can be caught prior to becoming a life-threatening disease.
My mom, she passed a colon cancer, and so since then, since it been present in our family, it was just important to me to go get screened. So I encourage my sisters to do it, to go get checked. Just go get screened. Like I said, go take care of yourself. Be here for your loved ones, because I wish, even though my mom, she did it, but I wish that she's here every day. And so just go get screened to take care of your health.